They had 1,375 participants with a mean age of 69 years of age, 57% that were male, 21% that reported foot pain. This is really important, that did indeed report foot pain. And of those who had foot pain, 13% of those were severe, 47% were moderate, and 40% were mild. But 1/3 colleagues reported having had a fall in the last year. So you can see that there were 263 that had one fall, but look at how many had more than one fall that were occurring, 152. So they found in this study that foot pain was associated with a 62% increase in the odds of having recurrent falls, which I think is really important and everyone should know, should really pay attention to, because these are people who are falling more than once. And we all know that when your feet are, when you're having problems with your feet, it affects your balance, it affects your gait, and it increases your fall risk. So those who had moderate and severe pain, they had even a greater increase, twice as much of an increase in having those 2.4 falls that were occurring. And that was respective to those who had no foot pain. And those who had flat feet, for their posture, that had flat foot posture, had a 78% increased odds of having 2 or more falls. So this is really, I think, important for all of us when we think about the importance of footwear, because the higher odds of recurrent falls were observed in these individuals with foot pain, especially those with severe foot pain, as well as those with plantar foot posture, the flat foot. So their assessment question, which I think is really very important that we should be adding into our screening questions on assessment for older adults, is on most days, do you have pain, aching, or stiffness in either of your feet? How many of you actually have an assessment question related to feet when you're thinking about fall risks